Director. I won't introduce all of the other SARD members on the call. You can see them. It will take a bit too long. So welcome to all the Sardinians and welcome to everyone that is joining us as well. So a little bit about us. As you probably know, we've got a very weird name, SARD. It stands for Strengthened Appraisal and Revalidation Database, and it ties directly into our history. So about 12, 13 years ago, I used to work for Oxley's NHS Foundation Trust, and in my role as Head of Learning and Development, I was tasked with building new systems for the Trust. They were very low in terms of their compliance around sort of normal appraisal, understanding, mandatory training requirements and various things. So I started off working with this chap called Kevin Monk, who can't be with us today. He's in another demo, who's the CEO of SARD. And he came into Oxley's and started to build some systems for us. The first one was lovingly named Pandora, because no one realized what it would open when we actually set it off. It was a negative reporting tool for mandatory training. And then after building sort of 3 or 4 systems within the trust, we were asked to build a medical revalidation system, which we did. And it had a working title of Strengthened Appraisal and Revalidation Database. When other trusts saw it, they were really interested in it. And so Oxley's took the decision to create a joint venture. We had very little time to think about things like names, so we just utilised the working sort of project title, acronym, and added a JV, which stands for joint venture. So for those of you who don't know, we are part owned by the NHS, which makes us slightly different from most providers and offerings that exist out there. It means that within sort of our DNA, the NHS is ingrained the whole idea of how we can help, how we can make things better, how we can improve things, stem from our history and where we grew up from, really. We're now 10 years old. When we started, we had one client, which was Oxley's. We then quickly took on another. 10 years later, we have over 50 clients that utilize numerous modules, which I'll explain in a minute, and over about 50,000 users. And our promise to everyone is very simple, and it's the same, and it's not changed since day one, which is that we provide great technology and great customer service. It's really important to us that we utilize innovative technology, make things simple, configurable, user-friendly. That's key. You need good engagement with these systems. I mentioned before that job planning needs to be something that goes somewhere. It can't just be a paper-based exercise. And integral to that is user engagement. You need people to use the system before you can really work on the quality of things. So that's the great technology side. The great customer service will hopefully speak for itself as I go through this. And I've got a couple of slides just to briefly touch upon that, but it's imperative to us that we maintain the highest level of customer support that we can. And that means all 50,000 users of our system have direct access to us. And we essentially term it as frictionless customer support. There should be no barrier between the users and the provider. It creates issues, it creates frustration. When you have frictionless, it means that we get constant updates, constant feedback from our clients, so we can make sure that through continuous development, we are making the system as good as it possibly can be. In terms of what we do, today we're here to talk about job planning for all, but we actually have numerous products. Starting, as I say, with medical revalidation, we then built MSF or 360, medical job planning, e-leave, e-rostering, nurse revalidation, and appraisal for all. We have a couple of other products that are open sourced. One of them I'll talk about a little bit later, which is called Murphin Plus, which is around capacity planning and links to job planning. And we also have an ESR API wrapper, which allows you to grab the data from ESR and present it in an accessible and usable way via APIs. So essentially talking to other systems, but not just for our systems. So you can utilize the ESR wrapper for essentially other systems that rely on ESR data. And as they're open source, they can be used by trusts without our input. We're of course happy to help to implement them, but there are instances, very recently a trust has implemented RESR APR APA without need of our intervention. So if you're interested in any of those products that I've talked about thus far, please contact us, contact Chris or Jan or myself, and we'll happily talk you through them. Also to note that we are currently developing team job planning, which is essentially covers over the top of the individual job plans for medics and for other clinical staff. So it essentially allows you to start looking at managing your contingency spend, making sure there's standardized tariffs around sort of admin time and various things along those lines. And it is imperative to what we'll talk about in a minute with regards to the levels of attainment. So those are the things that we do. So we've always done these things in partnership. So we never build anything without essentially working with one or more trusts to develop it. The reason for that is because we need to make sure that whatever we build works, and it has a practical application for the users of the system, and also for the sort of governance side of things, the back end, the reporting, where the data goes, how you use it, and how that informs sort of executive decisions around your resource and your capacity and how you utilize it. Alongside that, so outside of building these modules in partnership, one of the other things that's key nowadays is the idea of interoperability. And I utilize this slide a lot now when I do demonstrations, because from the centre, from NHS E&I, there's a very clear picture that they want to ensure that when you're gathering data, when you're undertaking processes, that information can flow freely between areas where it's required. And as the data is yours, you should be able to access it, you should be able to use it. So for example, just a simple example, if you undertake an MSF, that MSF should instantly be able to be pulled into your appraisal system as it forms part of the appraisal process. So if you had two separate systems and they weren't able to link, it makes life a little bit more difficult, especially if they're separate providers. So for us, we've always believed in the idea of sort of open platforms. And as such, we've developed our own ecosystem, but not just one that is restricted to our own systems. So it's very important to us that if you utilize one of our modules or more, that they have the ability to talk to each other, that data can flow between them. So we build API endpoints within our systems. And APIs, essentially, if you don't know, is a handshake between systems. It's how data flows between one system and another. Relevant data that's useful for other system usage. This relatively complicated looking diagram essentially shows that all of our systems talk to each other. But when you look at the little grey circles around it, it also shows that we essentially do our best to make sure that we can link to any other external provider systems. Nobody wants vendor locking. We don't want proprietary systems. We want to make sure that it's best in class systems that are in use, and if that data needs to flow, that it can. It isn't always up to us. We can't always force other providers to link to our systems, but we are capable, willing and able to do so. And there are some examples on here of where we've already established those links. And there's other examples of where we're currently establishing those links to make sure if we use separate system providers for things that are related, that the data can be transferred between them. So I just wanted to touch upon that, because I think it's important when you're looking at any system nowadays that you have almost sort of future-proof guarantee that you're not going down a dead end, that you have to then use all of the modules for one system provider. That shouldn't be the case. You should have options and choice. Levels of attainment. Now, this is important for a couple of reasons. One, why we built the system in the first place, and two, where trusts need to go with regards to things like job planning and e-rostering, but in this particular regard with job planning. So when we talk to trusts, most trusts are potential clients. Most of them tell us they're around level 0 or level 1. which is not where they want to be and not where they need to be. Most organisations can get themselves to level 2. Level 3 is a bit more difficult because team job planning isn't a widely adopted system approach. People do it, they do it internally and maybe team by team, department by department, but organisationally it's very difficult. And if you can't get past level 3, you can't get to level 4. So as I mentioned before, we're building job planning, team job planning. We've got a capacity planning system as well that we have in place. So we're trying to build the whole ecosystem around job planning, so you can get all the way with expedience from level 0 all the way up to level 4. And the reason why job planning for all comes into this is because it's relatively explicit that job planning should be for all clinical staff. So although we have medical job planning for a number of years, we needed to ensure that we could deal with the requirements for AHPs, CNSs and other clinical work groups. So that gives you a bit of a reason as to why we built it. A little bit more about us. So in terms of our experience, our sort of demonstrable experience of working with trusts over the last 10 years, as I mentioned, we've got about 50 clients, 50 plus. We've just taken on a couple more, and they range across the entire spectrum of acute community mental health, from very, very large trusts like Manchester, who have about 2,000 plus doctors, all the way down to some very small healthcare organisations that have in the tens of users. So it ranges a lot geographically, as you can see, there's quite a spread, and there's lots of names that you'll recognise. We currently look after 7 of the 10 Shelford Group trusts, so very large acute trusts. And the other thing that I think is worth noting is, because of the way in which we operate, the methodology of how we do great customer service and great technology, and how we go above and beyond where we can with support, we've got a great retention rate as well. And that's important because it essentially outlines what we do, can demonstrate in real time that these things work, that this approach works. So we currently have about a 94% retention rate over 10 years, which means very rarely do people ever leave us, and it's not due to inertia. There's often tendering processes where people relook at their options, and still, even though those things happen, as I say, we're still at 94%. So I just wanted to briefly mention the support side again, because I think it is really integral. When anyone's looking at any system, they need to think about a couple of things that are really important nowadays. One was the interoperability of a system. 2 is the sort of agile nature of the provider. Can they provide what I need today, but also can they provide what I'm going to need tomorrow, 6 months, 2 years, 3 years down the line? Because these processes changes, they're adapted, new things come in. Is the provider adaptable enough to make those changes? And one of the ways in which we are able to do those things, outside of the interoperability, which I've shown you, the adaptability of our system is based on 2 things. One, we've got a very technical heavy team. So we have our own developers. They know the systems inside out, they've built them, and they will continue to develop them. So that continuous development comes from our support system. Now, traditionally, in most providers' support methodologies, they have this idea that you have a central administrator, all of your users filter down all of their queries and potentially frustrations about how the system works to a central admin point within your trust. That administrator then talks to the provider. They list down the issues that you've got, along with all of the other clients they have, and they put them in a big list, they prioritize them, and then they do what's called version releasing. So every 6 months or a year, they will release a new version of the system, and maybe, if you're lucky, the requirements that you had will get into that new version, maybe not. They often talk about things like roadmaps. So if it doesn't get in, they'll say it's in our roadmap of development, and that can be X number of years long. And this sort of approach can cause real frustrations for end users. It creates friction, basically. There is no direct route. So what we do instead is we have our own support model, which we've utilized from day dot. As soon as we started, we introduced online chat. We have telephone support, we have videos, we have user guides, we have static help and feedback. We have a wonderful support team, and essentially what this means is every user of our system can directly talk to our in-house support team. It's no third party. We don't sort of push it out for someone else to deal with. It's all looked after and dealt with by our support team, headed up by Megan, who's the Director of Customer Support. And this has two benefits for us. The first is that it means that our users are engaged and supported when they're using the system, which means we don't have to train, which is an expensive way to deal with system implementation. As someone once said to me, we need to be trained on your system, we don't want it, it's too complicated. And that really resonated with me. So it means we have real-time support, and that's of use to the end users. It helps with engagement. But equally, what's greatly important to us is it means we have a constant flow of feedback. What's going on with this particular process? What's going to change? How is the system working for the end users? What can we do to improve it, to make it more efficient? And that's been a constant cycle for us over the last 10 years. So our systems do not look the same as they did 10 years ago. They don't even look the same as they did a year ago, because when new things come along, we know about it, and we can implement them quickly. And that can only be done by having a tech-heavy team. So about 80% of our workforce is either technical development or support, and that is a decision that we made to ensure that the systems work for our end users. So enough about us. Let's go and have a look at the system. So a couple of housekeeping things to go through in terms of the system itself. It's web-based, of course, so cloud-based, which essentially means if you've got an internet-enabled device, you can access the system in full. So whether it's via mobile phone, tablet, laptop, desktop, it's optimized for each of those. And as long as you can connect to the internet, you can get onto the system. We are and have developed an app for medical revalidation, and we are looking at apps for other modules that we utilize. But as I say, you don't need them to be able to operate it, because you can utilize it in full on those devices. So it is web-based. In terms of the screen that we're looking at the moment, I'm actually on the job planning for a demo user on here, but I'll just go back one step to the dashboard. You'll notice as I go through that I'll be working off this tab. The other tabs that I've got open that's a different system. That's a different system, and that's our website. So we try to ensure that there isn't sort of a plethora of open tabs that you need to go to do things, that you don't have to flick between multiple pages. All of our modules sit on one page, each one of them, for the relevant area that they're in. So on the screen that you can see now, you can see there's a number of modules. All of our systems are modular based. Every client of ours gets their own tenant, which means the system is yours. It's not a shared system that you utilize with other trusts. So any changes that are made can be made per trust. It also means that per individual, because it's role-based access, they can see different things depending on their requirements. So if you're just interested in job planning for all, you wouldn't see these other areas, these other modules, would simply switch them off, and it would change the way in which your dashboard looks. So typically, if you use medical revalidation, what you see up here is something to do with appraisal and revalidation. Now that will disappear if you don't utilize our medical revalidation software. Likewise, on the dashboard, it shows you your key dates. Again, you'd only see the ones that are relevant. Notifications are important because it tells you what's happening in the system, what someone's done, if someone's signed something off, if someone's left a comment, if you've done something, if you've added a document to it. It basically audits everything. We'll notice here that the chat box has popped up. I'll talk about that in a second. We then have some drop-down boxes at the bottom, and again, they will only show if the relevant modules are turned on. So in here, I can click on my job plans or your job plans, and it will show me my previous job plans that I've undertaken and a little bit of information about them, who the line manager was, when it was updated, what the hours show, and what the status of that job plan was. Also on here, we have supporting documents. So if you have your own trust policies around this, or any declarations or forms that you require to be filled in, this is yours. So you can configure this and add the documents that you require. In terms of the support, so I mentioned that I'll talk about the live online chat, which is this. You can just type away and say, hey, can you tell me about this? Or I've got to upload a document. Where would I do that? And one of our support team members will get back to you almost instantly. The sort of time between you typing and them answering is within the seconds. It's not minutes or sort of hours by any stretch of the imagination. So this can be utilized by every user of the system. People that are creating job plans, administrators, key stakeholders, it doesn't matter. Alongside that, we have these videos, online tutorials, we have the user guides, and again, these user guides only show if you have the relevant modules. We have information about key status icons, so if anyone's colorblind, because we use RAG statuses on this, we also put the key status icons in to make sure that it's clear what each symbol means. And then we have at the bottom right, static help and feedback. And that's the opportunity for you to look at information that essentially is static help. So it's there, it just gives you broad information about the systems, but also the opportunity for individuals to feedback. Now they can feedback on the online chat. You can just tell us if there's something that you think would be useful for the system. I think the best example or examples that I can remember is we used to have an issue with people attaching documents for some unknown reason, even though there was a big button that said attach documents, and a user came on and said, actually, it'd be useful if you had a paperclip, because that's what people are used to when they're attaching documents in other systems. So we developed it, put it on very quickly, and all of those queries went away. We do listen when people feedback to us. We do hundreds of feature requests all the time, and I'll show you in the admin section what that really looks like. So that's the dashboard side of things, to essentially tell you where you're at, what you need to do, and what's happened within the system, and provide you with your legacy data from sort of previous years. So if I go into job plan in here, so you'll notice there's a couple of options in here. You may be required to be a signatory. You may want to look at your old job plans. You have those options, but I'm currently in the most up-to-date job plan. Now, I just wanted at this point to visually show you how we got to this point and how configurable our systems are. So we developed medical job planning about 8 years ago now, when we developed it with Harrogate and District as the sort of first partner trust. And this is what we developed. Essentially, it's changed and more has been added since then. But visually, you can see that it's comprehensive for a medic. So there's lots of information in here that pertains to the medical roles around private practices, fee-paying services, additional to contract information. And you can see there's 11 sections in here, and you can also see that the categorizations of things like DCCs or SPAs are shown in hours and PAs. Whereas with our job planning for all, you can see it's a much cut down version. There is no PAs on there, it's all done in hours. And when we were building this in conjunction with other trusts, essentially the message was we want to keep this simple. That doesn't mean that our system can't add the functionality that exists in the medical side of things that would be relevant. It just means at this point, we've opted to keep things as simple as possible. And because we can continually develop the system, we both have the capacity to move things across if we need to, or develop around areas that may be associated with clinical staff like AHPs and CNSs that doesn't apply to doctors. So this one's got 4 sections, the other one had 11. As I say, it's not in PAs. So if we just go through this section on here, so it will obviously tell you your name, when your job planning dates, effective dates starts and when it ends. It has an activity summary, as I mentioned, which breaks down the categorizations that you put in, the number of hours, and then the percentage split on your job plan. This individual is supposed to do 40 hours. They've got 37 hours and 59 minutes. So they can still add to it if they need to. Everything can be PDF'd on here, so you can download it as a PDF if you need to take it away with you. If you want to store it electronically somewhere else, you can do so. The share as template, essentially what this means is if you want to create a template for a team, so you want to relatively standardize the job plan and say these are the things that should be happening, you can create a job plan, you can share it as a template, and then your team will be able to access that and build their job plan on top if they need sort of any nuance on it or if they need to add anything within it. So you have the option to do that here. You also have the option to do that in the administration side of things, so you can build a number of templates which people can utilize. The main actual job planning system itself, so there's 4 main sections in here. General information, now this serves for a couple of things. It serves for, it's informative, but it also allows you to drill down into the data when it comes to the reporting side of things, which is comprehensive in this system. So it will give you information about which directorate you work in, speciality, position title, your band, your employee number, your UK PHR number. It will also then talk about the start date, how many working weeks, and how many contracted hours you've got. Obviously, these you can see can be changed, and there are settings in terms of how the system will work for you. The next section on here is around signatories. Now, within our system, there is the ability of medical job planning to add numerous signatories. Within this, there's a sort of standard baseline of there needs to be a sort of 2-factor sign-off. So it needs to be signed off by the job plan owner and their line manager. If there is a requirement for more signatories, we have the capability to do that. And you'll see this when it comes to sign off, that this can be done electronically. So in terms of, you'll also notice, sorry, on here, there's an opportunity to comment on all of these sections. So you can add information in here which can be seen by you and your line manager. The main engine behind the job planning for all system is around this timetabling. And I just want to show you essentially a couple of views and then how you would add something new and what it means and how it can be configured. So within the timetable, we've got activities by day. So it will show you the things that you typically do on a Monday, typically do on a Tuesday, Wednesday, Thursday, Friday, and any flexible activities that you put in. So flexible activities essentially may be, you know that you need to spend 3 hours doing administration work or paperwork each week, but you can't necessarily put it in the scheduled time slot. You just do it when you get the opportunity, but you still have to do those 3 hours a week. So you put it in as flexible and it calculates the hours that you put in and then it moves them up into this sort of activity summary, so they become part of this. You can also look at activities by category. So it will show you all of the DCCs, SPAs, AR, for example. Now, there are other categories in this. It just so happens in this demo that they're the only ones we've utilised. And you can configure around different areas to make sure that either language or particular activity types can be put in. We've got a week overview. I don't think there is anything in this. There is. So these are the things that we would typically do on a Monday. It doesn't mean that these are the things we do every Monday or every Tuesday, Wednesday, Thursday, Friday, because you can see there's some that clash. So we can go to our main calendar look, and in here, this does show you the actual days that you're supposed to be doing certain things. So you can see on Friday, the 1st of April, I have a multidisciplinary clinic at 10 o'clock, but the following Friday, I've got service development. So the system is able to schedule things in for different days, different weeks within the sort of process of setting up a new activity, and then we can reflect that. The original aim of this was to look at the idea of exporting this into a calendar. The entire sort of activity creating system is based on the International Calendar Standard. So if you're used to using Outlook or Google Calendars, then it's not dissimilar in how it operates, but in terms of the basis of it, it is based on the same thing, the idea that you can schedule repeat events throughout a year. So within the timetable itself, I've added a number of things. If I want to add something new, I just click on New Activity. Again, very straightforward in here. We've got the different categories. In here, we've only got a few, but you can add different ones to this. So it may be that you require something else on top of these ones. It may be that you don't. Whatever I select in here, I can then add different activities below it, and they will relate to whichever section I've selected. So you'll see the SPA activities are different to the direct clinical care activities. And again, you have some ability to configure what they are so they match what works within your trust, what activities you wish to be able to choose when you're putting it together, but also report upon when it comes to the reporting side of things. So if I was just to select anything, I can select a location. Again, you can add locations that mirror whatever the locations are within the organization that you work for. I can give it a description, so I can say exactly what this direct clinical care is. I can define whether I'm on call or not. Most cases, it may not be on call, and that's fine. It would just default to no. It's only if you select yes that it will change it. And then I have the option to say whether this is a scheduled or flexible type. So if it's flexible, I'll just simply just put in what the duration is and how often it repeats. If it's scheduled, I will be able to put in the exact time that it takes place. Now, this can work all the way down to increments of 15 minutes, or as many hours as you are able to work contractually, well, meeting your contractual obligations. So if we were to schedule something, we're able to say, let's say it's 8 until 12, it happens weekly, and let's say it's over a 4-week period, I can say that it actually happens on weeks 1, 2, and 4 on Mondays and Thursdays. When I then save that, it will calculate what that means in terms of the hours that you're spending on that over the course of the attending weeks that you're there, how many weeks you're working. And it will calculate all of that and put it back into the activity summary and on all of those different tabs that we showed in terms of the overviews, and also represent what that means in terms of split. I think at the moment it was around 73% DCCs. If I was to add this, that would go up, of course. I won't add it because I'm sure I've chosen all the wrong dates, but essentially by clicking save, that will then come into here and it will appear on each of these sections where it's required to appear. Once we've done that, once you've got everything ready, you feel you've got all of your job plan sorted, you've got all of your sessions in, what you're planning to do for the year, you can then go to the sign-off process. And within here is simply a case of just signing off with here. There will be a little button that says sign off, and you'll be able to click it. This one doesn't, because in the demo site we've already done that. And it will allow you to see what's been done and what hasn't in regards to the admin side of things. So that gives you a perspective from a user side of things. So we wanted to keep it as simple as possible, make sure it was intuitive, keep it all on one page, make sure that individuals would be able to add things in a very simple and easy way. Again, as I mentioned before, if anyone was on here and they were like, oh, I can't remember how I add a new activity, just click on live support online, ask the question, and we'll point you in the right direction. So that gives you an indication of what the system looks like for a user. Now I just want to show you what it looks like from the administration side of things. So briefly, to cover off something I mentioned before, I said I'd demonstrate how we continuously develop the system. This is the admin portal, and this covers all of the different modules that we've got. So you can see there's comprehensive reporting for each of them. But when you come to the first page of the admin portal, what you'll see is the developments that have been undertaken within the system. And as you can see, there are loads and loads and loads and loads. So we are constantly updating the system. That doesn't mean it changes for the end user all the time and they're having to relearn things. They're often things that will benefit each end user. Because we have a tenanted approach, not all trusts need to take all updates if they don't wish to. So just as an example, in medical revalidation and appraisal, when trusts started to move towards the idea of an appraisal month as opposed to an anniversary date, not all trusts were ready to take that straight away. But because of the way our systems were set up, we were able to do it trust by trust when they were ready. Just something I wanted to show you on here, if I can, I don't know, yeah, it's on here, just in terms of how some things operate. So in terms of job planning, although this is for the medical side of things, this came in at the start of June with regards to there being a new SAS contract reform 2021. And then if we move all the way up to the 8th of June, this is us announcing that the contract was now in the system, accessible and usable for end users. So as you can see, it didn't take very long. The time it takes for us to implement sort of features and developments are based on the complexity of those features and developments and what other priorities we've got on at that particular point in time. But our tech team meet once a week to triage all of the feature requests that have come in, and we make sure we communicate with trusts what we're able to do in the shorter term and what may take sort of medium or longer term period of time to complete. So that gives you an idea. We have used the data sections. I won't go into it too much, other than to say within our user sort of management format, you can see lots of information about that particular user, all the way down to when the account was created, when they last signed in, how many times they've signed in. And if you use any of our other modules, it will talk about what they've got and things that they've got in those different modules. But on top of that, it gives you lots of other information as well. So these things are all related to this particular individual, and I can go in and look at their job plans, or I can go in and see if they've got a job plan exemption. In terms of job planning for all, as you can see, for the main job planning system, there's a bit more at the moment than there is for this. It's, as I say, it's still a relatively new system. There is always the opportunity to develop more. When we started medical revalidation, it did not have this much in terms of sort of back-end administration support. It's all been developed over time. In fact, this doesn't even show all of the things that we have now. ASPAT is new and that exists in there. It doesn't show on this demo site. But in terms of job planning, agenda for change on here, there's a number of things I just wanted to show you. And actually, while I do that, I'm just going to make sure it's picked everything up in this one. So yeah, just to show you that's what our new revalidation of MIM portal looks like. But in terms of the job planning for all, so a couple of things just to touch upon. We've got an all job plans, which essentially is every user that requires a job plan, any clinical user that's using this side, not the medical side. I can go and have anything that's in purple, I can drill down on. So I can either go and look at the user, or I can go and look at the last completed job plan or the current job plan if it's in draft. So that provides me with an overview. I can then, I'm going to move down a couple and I'll come back to these. We've got the job plan compliance report. Now on this, you can see, because everyone did their job plan at the same time in this system, they're all yellow, and that essentially means they are compliant, but within the next 3 months they need to redo their job plan. Once they've completed that, that will all turn green and they'll be completely compliant. It also gives me the opportunity to see statistically what that means. I have a filter option in here, so I may say, actually, look, there's obviously some people that are non-compliant. If I click on the non-compliant, it essentially will filter out this list and it will show me those users that are no longer compliant. And I can email them. So if I click on this, it will take me to my email client, and the email will come from me, and I can say, hey, blind copy them in, and hey, you're non-compliant. What's wrong? Do you need any help? How can we support you? Or likewise, I can click on compliant with an upcoming renewal. and there's 47 users in that case, and I can do the same thing. So it will show me the job plan compliance. It will then break that down based on sort of your ESR hierarchy. So I can look at it by directorate, and I can go into each one. So I can go into imaging, for example, and it will show me the breakdown of job plan compliance and all the users within that particular area. Likewise, by location, by team, by speciality. I'm not sure if this will pull the information in because I don't know if we've got it all set up. No. Okay, let's see. The specialities in there. Yeah. So if I want to look by speciality, so location and team will be the same. We'll just break it down, just that we haven't got those set up within this demo system. So I can then go in and have a look. So I may want to look at pediatrics. And again, it will show me the statistics, the visual representation of compliance, the opportunity to filter, and equally the opportunity to go in and say, right, this person is red, so I want to have a look and see what's going on. And it gives me an idea of what the picture is for that particular user. Outside of that, just a couple of things to note on here. So outside of the compliance reporting, we have activity categorization. And here's where I said to you within the drop-down lists, that you can configure what these things are to match your trust requirements of the activity categorizations. So you can do that. You can change that there. Activity locations as well. I picked, I think it was hospital when we were going through the main demo. Again, these can reflect whatever it is you require within your trust, and it's as simple as adding a new location and saving it, and then it will appear on the drop down list. We also have, oh, wrong one. We also have job plan templates, which I mentioned before, that you can do within the system. So if you're a department head or a team leader, you can create a job plan template from in here, give it a title, go in, add the data, and then when someone starts a new job plan, it will give them the option to utilize that template. All of the information that exists within the job planning for all system can be, all the activities can be exported via CSV. So if you wanted to query the information anymore, you could, and you just simply click on this and it would export the CSV information. The last thing I want to show you on here, and then there'll be about 10 minutes for questions, is the advanced job planning report. So essentially on this, it allows you to query anything within the system, so related to job plan. So if I want to look at just the DCCs within the trust, I can have a look at that, and then I can have a look at that against category. So I can start to break down, and let's do it in this one because I think this one's got more in it. I'll show you just so you can get an understanding of what it looks like. So I can do DCCs, and then I can have a look at the category of it. And what this will start to do, sorry, subcategory. What this will start to do is it will start to break down all those areas that you put in terms of location and the activities attached to those main categories like DCCs. I can then break that down further and have a look and say, actually, I want to see that by activity location. So clinical diagnostic work, what takes place in these locations. And it gives me a percentage splits. And within this, I can actually look at both medical and what is termed non-medical, but that's all other clinical staff. It will start to break things down. If I want to have a look at it in terms of hours or PAs, I can change that as well. So I can just click on this and it will just give me a breakdown in terms of hours. And then within each of these, if I want to look, let's say, at clinical diagnostic work in more detail within the hospital setting, if I click on it at the bottom, it will show me all of those users that have that within their job plan. Equally, I can download this as a chart, so I can then hand it out or email it on to other users that may wish to see it. I can download or export all of the information via CSV, which is useful if you wish to query the information anymore. Having said that, within this, you can query it to sort of like the nth degree. So you can define what the category activity type is. You can then choose from things like this. You just want to look at certain directorate splits, what the state of the job plan is, whether it's draft, submitted, completed. You may want to look at scheduled versus flexible time. You may just want to look at a particular directorate within this, and then it will break that down for anesthesiology, even a speciality, a location. So essentially, you can cut the data and query it in any way that you require to provide you with really useful information moving forward. The very last thing I'm going to show you, and I'm going to show it in the briefest way that I possibly can, is this is our Murphin Plus system. It's open source, can be used. You don't need us necessarily for it, but the essential idea behind this is, as you can see, is saying what was the average weekly planned patient contacts based on the job plan information, DCCs, against the actual average weekly information, which we're able to pull from patient contacts from patient record systems. And that's just to really give you a flavour, as I said, that we're looking to make sure that our job planning suite will cover everything that's required to make sure it's meaningful and leads nicely into the ability to rotor an e-roster effectively. But with that, there's only a sort of 8 or so minutes left, so I will be quiet. And if anyone has any questions they wish to ask, please feel free to do so. Oh, I don't know, breathe for a minute now. Has anyone got any questions that they have? I don't see any hands up. Maybe I've covered everything so wonderfully. There's no possible questions to be had.
Hiya.
Hi, Nicola.
It's not a question, it's more of a reflection, I think. It's just, I can see how comprehensive this system is. It looks straightforward to use. I can see staff getting on with it quite easily compared to some other systems that we expect them to use. What I suppose I'm struggling with, and it's probably my lack of knowledge around job planning, is how we could possibly use all of that information and make it meaningful and useful. It feels like it's almost a wealth of information, but we'd have to turn that into something useful. And that's the bit that I'm struggling with, I suppose. Yeah,
I think the main aim of job planning is actually, if the answer to that question is there's no way to do that, then although I'm not in the NHS anymore, I would say to trust, don't bother job planning, because it has to be useful. So that essentially the idea behind it is that historically people have job planned and they've said, this is what I think I'm going to do. And then if they're doctors, they'll get their rota, and then they'll get their roster, and they'll go away and they'll do the actual. And then things will change, of course. People are unwell, or sometimes they're needed, or they're on call, or various different things. And the two have always struggled to reflect each other. What a trust really needs is for their job planning, which is essentially what it says it is how you define your resource and how you're going to utilise it within your trust over the forthcoming year. Now, even if they were really closely aligned, back in sort of February, March 2020, when the pandemic hit, of course, all of those things would have gone out the window. But that, that's the way it is. Having said that, now we've been through that, we can ensure we understand contingency and how we deal with things. But in order for an average year for a trust to be able to optimize that data, having it all in the system, broken down by location and activity and all of your clinical staff, allows you to utilize it to build a picture. With something like Murphin Plus, for example, you can build a picture in very quickly. This is what we said we were going to do. This is the actuality of it. And it allows you to have conversations to say, right, you put in there, you do all of this direct clinical care, but reality shows that you don't. And they may say, actually, I do a lot of educational work. Well, that should be reflected in your job plan. Because if I have 10 whole-time equivalency CNSs, for example, and I believe, based on their job plan, that they're doing lots of direct clinical care, but they're not because of other things, the job plan needs to reflect it. If it doesn't, then I don't know what resource I've got. So it is, I think it is a bit of a new world, and it can maybe seem a bit confusing and a little bit overwhelming, but by simply being able to access that data, we can start to build around things that help to inform those decisions about capacity, not even just demand, but acuity and severity. So we understand, you don't just have one nurse on a ward to look after 10 patients. It may be, if it's ICU, you have 2 nurses looking after 1 patient. In another ward, you may have 1 nurse looking after 10 patients. It's different, but the point of this is to arm you with that level of information. Murphin Plus takes it to the next step, so you can compare it. We also have a rostering system where we'll be able to utilize that information to make sure that sort of the rosters reflect what the reality is, and then over time your job plan should start to be more accurate. I know that was a really long answer to not a non-question, but does that help all?
It does help a bit. Can I ask two related questions? So when you showed us Murphin Plus, the actuals were coming from the patient record system, is that right? So it's pulling some information from, so we use System 1 in our trust. Is it pulling some information from there to?
This one isn't from that particular system 1, but we are happy to work with you to pull that information in. Essentially, Murphin Plus is the idea that you can compare 2 sets of data, and as it stands, it pulls job planning data from our system and data from another system, and that in this case is just around patient contact. It essentially in the future should be able to do more than that. I mean, we did a demonstration on care hours per patient day, I think is the term, and you can compare those things. So essentially, yeah, we'd need to establish a link to be able to derive that data. But yeah, I mean, this unfortunately doesn't have any great data, and otherwise you'd see this should mirror this a bit more. But there's still some areas of development we're doing on this.
And in terms of the rostering piece as well, would you normally expect a member of staff to have a job plan and also be rostered, or is it one or the other?
I would expect, so for the medical side of things, I'd expect obviously for it to be both. If there's a rostering requirement, then yes, both, for all sort of members of clinical staff that are required to be rostered. The job planning side of things should literally just be there as it says, as a plan. The reality of what you do is based on your rota or roster, depending on who and how that's set up.
Okay, thank you very much.
No worries, thanks for the questions, Nicola. Is there any other questions that anyone has?
There is a question in the chat there, yeah. If I read it out, yeah, Susan. Is there a way for managers to put in the service requirements, for example, number of theatre sessions over a year, so that it can evaluate that against the job plans in the team to be sure all service requirements are deliverable?
I don't necessarily. I think you'd be able to put information in about it. I don't think you'd be able to set the system up to necessarily compare directly against that in here. However, in the team job planning system, that's exactly the sort of thing you'd be able to pull the data from this, and it would be able to show you team by team or service by service what those sort of set requirements are and whether you're hitting them or not. Once the team job planning thing is in place, it will obviously then allow you to maneuver between the individual job plan and the team job plan. I don't think, as it stands at the moment in here, though, there is a way to necessarily define that. You would be able to have a look at that, however, on the advanced job planning report, as long as those activities were labelled, but the sort of limit that what you're hoping to achieve wouldn't necessarily be set in here, but you'd be able, if you knew what that number was, for example, you'd be able to see from the advanced report whether or not you would hit that, if that makes sense. So it's more in team job planning. There will be the ability to have a look at those things as long as things are properly labelled within the system. So it's a bit of a halfway answer, but certainly in team job planning, yes. Okay, well, I think that's about our time for now. So I would firstly like to thank everyone for attending. Chris and Jan will follow up just to see if you've got any other questions, if you require any more information. We will be posting this recorded webinar, so you can watch it again if you want to spend another hour listening to me. I'm sure you don't, but if you do, you can. If you wish to share with any other colleagues, that's fine. If you want a more in-depth look at anything else we've got, please let us know. We will have another webinar coming up. I think it's in April.
May.
May. I'm not entirely sure which one it is for, so does someone know on it?
Nursing.
Nursery validation. Yeah.
Yes, nursery validation. There you go. So we're doing a nursery validation. So if anyone's got any colleagues that I think will be interested in seeing what we're doing there, please let them know. Ask them to contact Chris or Jan, and we'll set them up. But beyond that, as I say, thank you very much for your time. Any questions you have, please reach out, and we'll happily do our best to answer them. And last thing to say is have a wonderful day, everyone. And again, thank you for attending. So take care.
Thanks very much. Bye.
Thank you.
Thank you.
Bye-bye.
Thank you.